Bonjour et bienvenue à notre réunion de midi en ligne et en direct sur EBS. Nous sommes aujourd'hui le jeudi 18 novembre. Nous n'avons pas d'annonce particulière pour vous aujourd'hui, hormis celle de vous rappeler qu'une réunion des ministres chargés de la cohésion se tient aujourd'hui de l'autre côté de la rue. La commissaire Elisa Ferreira y représente la Commission. Les ministres discuteront notamment de comment les programmes de la politique de cohésion peuvent contribuer à la relance, aux transitions écologiques et numériques et à la cohésion économique, sociale et territoriale. Une conférence de presse avec la commissaire Ferreira est prévue pour 13 heures. Je vous remercie donc de réserver vos questions liées à ce sujet à cette conférence de presse. Voilà qui termine nos annonces. Y a-t-il des questions pour nous aujourd'hui? Alors, je vais passer la parole à Mindaugas. Mindaugas, you have the floor.
Hello, good morning. It's nice to see you. My name is Mindaugas Laukagalis. I'm from Lithuania National Radio and Television, and I have a question on migration and Belarus in particular. Just some context, Lithuanian foreign minister says that EU negotiations with Lukashenko are de facto happening and it's dangerous to negotiate with a dictator. So in relation to that, I have two questions. So first of it, yesterday you said that the Commission is due to hold technical talks with Belarus. So could you just tell us a little bit more about the content of these talks and whether the EU is ready to sacrifice some sanctions or strong position about Belarus actions for humanitarian reasons? And the other question is that we are hearing some reports that some countries are vetoing sanctions to Belarus national airlines. So does the Commission still stand firm for sanctions for airlines such as Belavia, Belarus national airlines, that help to get migrants to the EU border? Because you've stated that before. Thank you.
Thank you very much, Mindaugas, for these questions and for giving me the opportunity to clarify the situation. As we have said clearly yesterday, there is no question of negotiating with the Lukashenko regime. What we have announced yesterday is that we will hold technical talks with the UN agencies, in particular UNHCR and IOM, and the Belarusian counterparts in order to facilitate the repatriation of people who are at the border. That is the focus of the talks, as well as, of course, as continuing to try to facilitate humanitarian aid to people who are at the border in Belarus. That is the only thing that we have announced yesterday. There is no question of any type of negotiation with the Lukashenko regime. On your question related to sanctions, absolutely nothing has changed. Our position remains exactly the same as it was before when it comes to sanctions concerning Belarus. Mindaugas, you have a follow-up.
Yeah, just a quick one. Could you just clarify once again what is the Commission's position on sanctions and in particular to the Belavia, Belarus National Airlines? Thank you.
I will ask Peter to provide you with the details on this. Thank you.
The position is very clear and was formulated or outlined by foreign ministers of all 27 member states for the last time during their Foreign Affairs Council this Monday. And the position is that they agreed on enlarging the scope of existing sanctions against Belarus, also to include those who are participating, those people and entities who are participating in this illegal and inhuman practice of human trafficking and instrumentalizing of the migrants. Now the work is being finalized in the working group among the member states about the concrete listings. That means finding agreement and final outline of the list of those who will be sanctioned. These discussions, as always, are taking place among the member states in the Council in the atmosphere of confidentiality, and we never disclose any details about ongoing discussions about who will be or who might be on that sanctions list.
Thank you. Are there other questions on this issue? Yes, please.
Josef Berg from Estonian Public Broadcasting. I would like to ask a question about the calls that Chancellor Merkel had with Mr. Lukashenko. Could you tell me if there was any mandate given to the Chancellor Merkel to represent the EU anyway on these calls?
The European Union is really not in the business of giving mandates to member states. Member states obviously have bilateral contacts with anyone they wish. That is absolutely normal in diplomacy. Obviously, there are very close contacts at all times between the European Commission and the various EU member states. Any other question on this for us today? That is not the case. Let us therefore see if there are other questions related to foreign affairs, since Peter is on the podium. So please only keep your hand raised if your question is on foreign affairs. Yes, Khalid, I think.
Khalid Hamid Faruqi from Geo Television News. Day before yesterday, a doctor and 2 traders have been shot at in fake encounter in Jammu and Kashmir, Indian-held Kashmir. And inquiry obviously have been announced, but 506 inquiries have been announced on fake counters till now, but only 1 was conducted. This is the Indian security forces conduct in Indian-occupied Kashmir. What you have to say about you are having a human rights dialogue format within the summit, which took place in Porto, Portugal last time. Where are we on human rights with India? Thank you very much.
So this is actually more for Nabila. Nabila.
Thank you, Khalid, for your question. Look, on the incident itself that you're referring to, I will have to check because I don't have the information. But I would like to recall our position in general, which is that we follow developments in Jammu and Kashmir closely, and that the EU's consistent position worldwide is that allegations of human rights violations be investigated in line with the international human rights commitments wherever they are committed.
Thank you. Other questions on foreign affairs for us today? I see only 1 hand raised. Selen.
Selen Temizler, Anadolu Agency. What's your comment on the Dutch journalist working in Greece and was attacked and then advised to leave the country following her questioning of the pushbacks at a press conference with the Greek Prime Minister? Thank you.
Selen, I'm afraid this is not a question on foreign affairs. Let me see if there are other issues related to foreign affairs before we move to your question. That is not the case, so I believe that would be for Christian, if we have any comment to make. No? Okay, we will have to look into this and we will come back to you if we have any information. Philippe.
Oui, bonjour. Désolé de revenir un instant sur la Biélorussie, mais je pense qu'on est un peu sur les deux sujets. Je voulais simplement profiter de l'occasion qu'on en parlait pour demander si le commissaire Skinas poursuit son grand tour après l'étape turque qui a lieu aujourd'hui, si je ne m'abuse, et s'il est possible d'avoir déjà un petit peu un bilan des accords qu'il a obtenus à gauche et à droite en matière de gestion de cette crise avec la Biélorussie. Merci.
Merci. Je n'ai pas d'informations particulières sur les réunions qu'il a aujourd'hui, mais ce qui est clair, c'est que les contacts continuent et les résultats s'accumulent. J'en veux pour preuve que nous venons de voir une annonce par l'Ouzbékistan sur le fait qu'ils allaient limiter les transferts de passagers vers la Biélorussie aux citoyens de ce pays ou aux personnes ayant des visas permanents pour ce pays. Enfin, vous pourrez vérifier les détails vous-même de l'annonce faite par l'Ouzbékistan. De même, le Liban a annoncé aussi des restrictions quant au vol vers Minsk, vers la Biélorussie. Vous savez aussi que la semaine dernière et cette semaine, toute une série d'autorités nationales d'aviation civile, par exemple l'autorité turque d'aviation civile, ont annoncé des mesures de restriction en ce qui concerne les vols vers la Biélorussie, ainsi que la compagnie aérienne syrienne Wings. Donc ce que l'on voit très très clairement, ainsi que les autorités des Émirats arabes unis, donc ce que l'on voit très clairement, c'est que les activités du vice-président Skinas et de la Commission européenne en général pour s'assurer que les compagnies aériennes ne se rendent pas complices de ce qui est un trafic de personnes vers la Biélorussie, ces efforts sont très clairement couronnés de succès et nous allons continuer afin de nous assurer que personne ne tombe dans le piège qui est posé par le régime de Loukachenko et qui est posé par les personnes qui organisent ces trafics et qui font que des personnes se retrouvent en Biélorussie à la frontière avec des pays de l'Union européenne sans que cela leur donne l'opportunité, les opportunités qu'ils recherchent. Donc voilà où nous en sommes aujourd'hui et les efforts continuent. Y a-t-il d'autres questions pour nous aujourd'hui sur d'autres sujets? Yes, Marta, pardon. Sorry.
Hi, Eric. I'd like to know if, taking into account the new rules that Belgian government has approved yesterday to constrain the virus and all the infections spreading in Europe, I guess the European Commission is planning to change something about its meetings, the briefings, or the press conferences. Thank you.
So when it comes to your presence in the press room, I think that the first thing to say is that obviously your employers will be normally, taking measures vis-à-vis your working conditions and your teleworking, which means that here in the press room, normally we should not see a major influx of journalists. And indeed, if I look at the presence that we've had every day and today in particular, we can see that social distancing rules can easily be respected. And I invite you to do so by using all of the available space. When it comes to the Commission, obviously we have seen what are the rules that have been decided by the Belgian authorities, and we will be looking into it. But Marta can provide you perhaps with a bit more detail. Go ahead, Miriam. Sorry, I don't know why. I'm confusing all the first names starting with M.
So, as Balas has repeatedly said in the podium today, I'm replacing him, the safety of our staff is of our utmost importance. And we have been implementing very successfully since the beginning of the pandemic an adjustment of our ways of working to be fully operational despite the circumstances. We have always followed and we continue to follow the host country's recommendations on safety and health. In this context, in Belgium, we will ask our staff to telework 4 days a week from Monday, as it was decided yesterday. These measures, of course, will not apply to the critical staff and staff to which teleworking is incompatible. And we will continue to maintain all the strict rules on physical distancing and wearing of face masks in all Commission buildings. in line with the rules in place.
On this, Matthijs?
Yeah, it might be a very blunt question, but if we show up more than one day in a week at this middays, are we being told to leave the room then?
Matthijs, again, you have an employer, right? And your employer normally should be telling you what are the rules that you should respect. Therefore, we count on the fact that people will be responsible in how they apply the rules of the host member state. We are not a control organization. It is for each employer to decide and to implement the safeguard measures which are put in place by the Belgian government. As far as we are concerned, we have put in place a dual system, and that since the beginning of the pandemic, both virtual and physical, which therefore gives you all of the means that you need to respect the rules as they have been set by the Belgian authorities. Any other questions on this issue? I see two hands raised. Yes, Marta, you have a follow-up on this.
Yeah, it's okay. It's about coronavirus. I don't know if I should. Yeah.
Hold on. Let's focus first on the issues related to Commission working practices. I see that Romana. No. Okay. There is no further hand raised on this. So thank you very much. Now we'll pass the floor to Romana, who had been asking the floor for some time.
Can you hear me?
Yes, go ahead.
Yes, go ahead. Okay. I had a question on the digital COVID certificate. There's a rumor that it will expire after 12 months. Could you tell me something more about that?
Thank you, Romana. We don't deal with rumors. There are actual facts when it comes to the validity of the regulation on the European digital COVID certificate, and Christian will be happy to refresh your memory.
Yes, hello. Good afternoon. Thanks for your question. Indeed, as Eric just alluded to, first of all, let me clarify that the regulation as such on the digital COVID certificate is limited in time for 1 year, with the possibility to prolong it. And we have already said that we are looking into this and that we will look into a possible prolongation also in the context of the next implementation report that we are going to do 3 months before it expires. But this is of course something that we are looking into. But in principle, the regulation is limited to 1 year with the option of being prolonged. But I think where this, well, while I cannot comment on your rumors or speculation, but of course we had these discussions before in the context of the question of the validity of vaccination certificates. And what I can say there, maybe also to further clarify, is that our EU rules on the digital COVID certificate currently do not foresee expiration of vaccination certificates. Our aim remains very clear. We will continue to facilitate safe, free movement and a coordinated approach across the EU on the acceptance of the COVID certificates for travel within the European Union. Discussions on ensuring a coordinated EU approach to free movement and continuing this approach are ongoing, and we are currently discussing this with the ECDC and EMA as well as with member states on the way forward. The Commission is currently preparing an update of the applicable rules, namely a revision of the free movement recommendation, and this will include also elements in relation to the validity of the vaccination certificates, and you can expect this quite soon. As regards the domestic uses of the certificate, I think there we have been clear enough that you also need to distinguish between travel between member states and domestic uses.
Thank you very much. Are there other questions on this? Romana, you have a follow-up.
Next week or this month?
Sorry, we didn't get that. We missed the beginning of your question.
Sorry. You said you can expect an update on the regulation this quite soon. Would that be this week?
I was saying an update on the recommendation, and I was saying very soon, and I will stay with that.
Romana, you need to remember that the framework, the regulatory framework in this context contains various elements. You have a regulation that defined basically the fundamental traits of the European digital COVID certificate, so that we have one unified technical solution across the EU in order to facilitate travel by having one technical standard, basically, when it comes to the information related to the health situation of European citizens who want to travel, whether they are fully vaccinated, whether they have recently done a test, or whether they are recovering from COVID and therefore have antibodies. So that's the regulation. Then you have a recommendation from the Commission that relates to the underlying health elements of what vaccination means, etc., etc. Christian can provide more details. And then you have a third recommendation which relates to travel from third countries. And we have always been describing these various elements as a sort of overall package, but each of the elements has its role to play and its specificities. Obviously, a regulation, as you know, is binding on member states, which is not the case of recommendations. So you need to always take into account these differences between the different texts. All right, any other questions on the European Digital COVID Certificate? That is not the case. So we will go to the other dimensions related to health situation. Marta.
Hi, I know that national measures are health measures are national competence, but considering the spread of the virus all around Europe and the different measures that different countries and governments are adopting, I wonder if the European Commission should intervene to try and coordinate these different measures in whole Europe.
Thank you. Well, this is a question for Stéphane. There is already a lot of coordination taking place, Marta. Since the beginning of the pandemic, and the Commission has been active with member states in terms of coordinating this. But I let Stéphane remind you of the details.
Thank you very much. You're absolutely right to start your question with the fact that vaccination policies, the design and implementation of vaccination policies, is a national competence. So, but obviously it is also important that we can assure a coherent and coordinated approach at the European level. This is indeed one of the reasons why there's several mechanisms that have been put into place, such as, for instance, the Health Security Committee, which is a committee bringing together representatives from the different health ministries, where they bring to the table common challenges, concerns, questions, approaches that they intend to follow, that they would like to discuss with each other, the state of play of vaccination and so on. So we have a very strong, I would say, coordination mechanism that helps us to do this. Of course, there's also the political level with meetings of health ministers, the fact that Commissioner Kyriakides is offering strong political support by going through these member states where we see, for instance, higher or still challenges to increase the different vaccination rates. And there is also, obviously, in the context of this working together, the civil protection mechanism, which can be triggered whenever a member state feels the need to have support from other member states. And this is a mechanism that has indeed been used already several times in this context. Thank you.
And let me remind you that we have consistently passed the message and will continue to pass the message on the importance of getting vaccinated as the first most important measure. And secondly, respecting the health safety measures that have been recommended, in particular by the European Medicines Agency. So obviously, it is clear that it is important for everybody to stay focused on ensuring maximum vaccination rates across Europe, but also that we all continue to be rigorous in our application of safety measures. And I'm very happy to see, for example, that you are all wearing your masks while here in this press room. This will all help us fight the pandemic. Any other questions for Stefan on health-related issues? Yes, Jessica.
I just wanted to ask, given what's happening in many parts of Europe, do you think the vaccination strategy, the EU's vaccination strategy is working?
Stefan.
Well, again, the design of vaccination strategies within the member states, the implementation of vaccination strategies within the member states are national competences, is a national competence. This being said, we have set up at EU level our own vaccination strategy, which has led to the availability of billions of doses. We also see remarkable increases in vaccination rates, and we also see reductions in infections. Although, of course, this is extremely, we are witnessing also increases in some areas. But I think we could say that at the EU level, the EU vaccination strategy has definitely been a success. This does not mean that we should, that there is no cause for concern. There is definitely cause of concern, in particular the fact that in some member states vaccination rates are low, that we are witnessing indeed increases of infections. But this should not make us forget that the role that we have played here at the European Union is to make sure that sufficient vaccines are available, vaccines that are safe and effective, effectiveness and safety being acknowledged by the European Medicines Agency. And so the work is, as Eric said, continues to focus on vaccination and obviously take into account the different non-pharmaceutical measures such as keeping distance and so on. Thank you.
Thank you very much. Any other question on this for us today? Mindaugas, you have a question on the COVID situation.
Yes, I do indeed. Thank you for the floor. So could you just give us an update about EMA's approval for vaccinating children from 5 years old? Because EU, I think, is a little bit behind. For example, America, which is already doing that. And the other question, or approved that. And the other question, what is the Commission's position on national COVID health passes for underage children, for young children from 12 years old? Do you approve that, or do you think the health passes should be only for adults? Thank you.
Stefan can answer you on the first question, but the second question is should have been dealt with by Christian when he was here on the podium before. But Stefan, on the first question.
Yes. I'm afraid that on this first question, you should direct it to the European Medicines Agency, which is an independent agency doing the assessment of the vaccines, also the assessment of to what extent such vaccines can be used indeed for children from 5 to 11 or 6 to 11, depending on the type of vaccine. So it is in their hands, but I understand that the evaluation is ongoing, but they can give you more information on that. Thank you.
And on your second question, let me remind you that the regulation on the EU digital COVID certificate only concerns travel between member states. I don't have at the top of my mind what are the age, what are the age limits, the lower age limits for having a certificate, but we can come back to you on that. But it is not one of our duties or prerogatives to basically discuss the use of certificates within the member states. This is quite clearly a member state prerogative. Anna, a question on the COVID situation.
Thank you very much. Good afternoon, everyone. I have a question indeed, because what are the benefits of the vaccination? Because on the example of Gibraltar, where they had vaccinated not only their own community, 100%, but also 18% of travelers. So altogether, Gibraltar had 118% of vaccination plus 40% of boosters. And now we heard that they have to cancel the Christmas, they cancel all the events, and there are measures in place, and all happens as the previous year. So what are the benefits of the vaccination?
I think the benefits of the vaccination are abundantly clear, Anna, and I'm sure Stefan will have great pleasure in reminding you what they are.
Indeed, it is with a great pleasure that I would like to stress you a couple of very important things on the effectiveness of the vaccines. First, medical scientific data show that they are extremely effective against severe disease, including hospitalizations and deaths, and that the effectiveness remains high at approximately 80% effectiveness. There is, however, some evidence of slight decreasing protection in older, frail individuals and those with clinical risk factors for more severe disease. So this means that the vaccines are achieving what they are supposed to do, protecting people from getting severely sick and dying from COVID-19. Also, in the past pandemic waves, an increase in infections meant also an increase of hospitalizations and death rates. In the current pandemic, this is no longer the case. Increasing infections no longer entail necessarily more hospitalizations and higher death rates. This is another clear sign that the vaccines are doing their job. According to the ECDC as well, the current increase in numbers that have been reported, numbers of reported COVID-19 cases, we see that this is mainly driven by and also affecting unvaccinated or partially vaccinated individuals. And I think I already referred to this last week, in its risk assessment of September 2021, the ECDC had already indicated that lifting protective measures without having reached a sufficiently high vaccination uptake of 75% would lead to a rise in cases between September and November, and this is exactly what we have been noticing in some cases. So the message remains very clear, as Eric said, vaccinate, 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 but of course we also need to bear in mind the importance of the non-pharmaceutical interventions. I hope with this, Anna, that your doubts have disappeared. Thank you.
She nevertheless has a follow-up. Anna.
Thank you very much. I appreciate what you told, but I addressed you with a very specific question because Gibraltar community is the most vaccinated community on the planet Earth. They vaccinated 100% the inhabitants plus 18% of travelers. So they are vaccinated 118%, and still people are hospitalized or people are dying, and they have again very severe sanitary measures in place. So where is the benefit? Because there is no resolution of the problem, that I would like to say, but you repeat that we have to achieve maximum vaccination. But what does it bring to us to achieve it? Because people of Gibraltar achieved maximum vaccination, but they didn't achieve the result because there is no freedom. There are measures in place, and the future is obscure because boosters doesn't bring result either.
Anna, we have never said that vaccination on its own would solve the pandemic. So that is a very simple answer to your question. Secondly, the pandemic is not something which is static. It is something that unfortunately is evolving. And therefore, the response by the national health authorities and at our level by the European Commission when it comes to providing vaccines and ensuring that we have all the necessary medical equipment, et cetera, will also need to continue to evolve. But the question is, what would the situation be without vaccines, Anna? And the situation without vaccines, we saw it at the outbreak of the pandemic. Right? Remember what the months were at the beginning of 2020. The number of hospitalizations and deaths that we had in Europe. And therefore, it is quite extraordinary that after so much time, we still get this sort of question on what are the benefits of vaccines. Think about what the death toll would be. That people continue to be hospitalized, yes. Actually, many people who are hospitalized across Europe are people who are not vaccinated. And if you look in percentage terms, I'm sure that you will see that it is even more so the case. But the severe forms of the disease and the death toll by inhabitant are now not comparable with what we had at the beginning of the pandemic. That being said, we need to continue being careful. So let me make it 100% clear, Anna. The Commission is not changing its position when it comes, it reaffirms its position when it comes to recommending that everybody, including you, gets vaccinated. David, une question sur ce sujet. David, tu tousses. J'espère que c'est juste un rhume. Pardon,
Hello?
je ne peux pas m'empêcher une petite blague. Je t'en prie, David. Tu as la
Hello.
parole.
This is David Price. There's so many Davids. Can you hear me?
Yes, David.
Okay, thank you. I was a bit confused at the beginning. Yes, I asked a question at the beginning of the year about natural immunity. That this is about whether the Commission considers this to be the best option. And I haven't heard the word natural immunity being used much, if at all, in the months since then. And at the moment we see, as Anna said, you've got countries like Gibraltar, but you also have Iceland and Israel, which have massive amounts of inoculations, and yet they seem to have the highest problem at the moment. So I'm wondering whether, and if you compare Sweden, for example, which has got a different policy altogether, whether the policy of the inoculations should be reviewed in the light of the present trends.
Look,
so the two questions, one on natural immunity and second one on the fact that the most highly inoculated countries are having the biggest problems at the moment.
Look, David and everybody, I'm not going to repeat this 100 times. The Commission is recommending that everybody gets vaccinated. Full stop. On your other question on natural immunity, I don't know if Stefan has something to say. I'm not actually sure what you're referring to.
No, but I admit that it's also, for me, not entirely clear what you're referring to. But again, when you look at the figures, when you look at the figures from ECDC, from EMA, you see that vaccination is the best way, the most important tool to tackle this pandemic. And therefore, yes, we go full Monty for vaccination. Thank you.
David, you have a follow-up.
Is when you get a mild form of the disease, and then you don't have a problem later on, and the immunity lasts upwards of a year or more. So it's obviously better if people get a mild form of the disease and then have something which is probably better than inoculation of an experimental mRNA product. And the other factor is that if you look at the death rates from COVID, it's only the older people who are most vulnerable. Children do not have a problem, yet they have problems with vaccinations. The mortality rate of with the COVID is something like between 95 for the older, the seniors, the very old seniors, to
David, what
99.
is your question, please? We're
Well,
not going to transform this press room into a debating society on the advantages and disadvantages of vaccination. Let me make that abundantly clear. We have a European Medicines Agency that actually has provided and continues to provide its analysis, and we respect what is said by the European Medicines Agency. So if you want to debate the virtues or not of various types of strategies to fight the pandemic, I invite you to do so with the experts of the European Medicines Agency. Here, we have set out our position, and I'm sorry, but I'm not going to engage in debates on this here over the course of the midday. So if you have a very specific question, I'm happy to hear it. Go ahead. It does not seem to be the case. Thank you. David Carretta, you had a question. David, je te passe la parole.
Oui, pardon, j'ai des problèmes parce que je tout pas, mais j'ai 2 enfants à la maison et tu imagines peut-être pourquoi. Donc voilà, je vais essayer de reformuler la question parce que en parlant avec les personnes normales au dehors de la bulle européenne, on a une perception. Et la perception, c'est que oui, les vaccins marchent très bien. Mais on a créé une sorte de expectative dans les gens. On va sortir de la pandémie et retourner à la vie normale grâce au vaccin. J'ai devant moi un tweet de la présidente décembre 2020 pendant un discours au Parlement européen où elle a dit « To end the pandemic, we need up to 70% of the population vaccinated ». Donc voilà, le message qui est passé à l'extérieur, c'est ça. Et aujourd'hui, on se retrouve dans des pays qui ont vacciné 90% de la population adulte, etc., qui se referment, où la pandémie, évidemment, n'est pas terminée. Alors, je voulais te poser 2 questions. Est-ce qu'on n'a pas exagéré sur le message positif par rapport à la fin de la pandémie, grâce au vaccin? Et deuxième question, quelle est l'évaluation de la situation épidémiologique aujourd'hui de la Commission européenne? Parce que ça, c'est important aussi pour la libre circulation des personnes et tout ça. Donc, la présidente a des conseillers scientifiques qui sont très bien, mais on voudrait savoir quelle est son évaluation de l'évolution de la pandémie. Merci.
Vas-y, si tu veux.
Merci beaucoup, David. Il y a plusieurs choses que je voudrais quand même souligner ici. Et Eric a déjà fait référence à ça. D'abord, la situation évolue évidemment tout le temps. Nous avons vu l'apparition de variantes, par exemple. Il faut aussi prendre en considération que la situation peut être très différente dans les différents États membres. Ensuite, et je voudrais réitérer ce que je viens de dire, l'ECDC, dans son rapport de risque, a indiqué que les États membres qui n'ont pas atteint, ils ont indiqué ça dans leur rapport du 30 septembre, si je ne me trompe pas, les États membres qui à ce moment-là n'ont pas atteint les 75% de vaccination risquent de voir une augmentation importante d'infections en cas de laisser tomber les mesures non pharmaceutiques. Et donc, c'est ce qu'on est en train de voir dans plusieurs parties, je dirais, de l'Union européenne, que le taux de vaccination n'était pas encore très élevé. On a, je dirais, rendu les mesures non pharmaceutiques un peu moins strictes, et on voit dans certaines parties de l'Union européenne, en effet, une augmentation des infections. Est-ce qu'on fait une évaluation? Tout le temps, évidemment. Notre agence, l'ECDC, fait des risk assessments, des évaluations de risque. Ils sont en train, si j'ai bien compris, de travailler sur un nouveau risk assessment, dont le but, c'est exactement de suivre la situation de la vaccination dans les États membres, les mesures qui ont été prises et quelles recommandations s'imposent pour l'avenir, prenant en considération ces expériences du passé.
Merci beaucoup. Et permets-moi de rajouter qu'à l'époque où nous avons lancé cette campagne pour obtenir des vaccins qui suffiraient à couvrir 70% de la population, souviens-toi à quel point cela vous paraissait, ainsi qu'à nous d'ailleurs, un objectif extrêmement ambitieux à atteindre. Et nous avons atteint cet objectif et il a incontestablement contribué à largement améliorer la situation en Europe. Mais nous avons aussi toujours dit qu'il fallait faire attention, car d'une part, il fallait continuer à prendre des mesures de précaution, et deuxièmement, qu'il ne fallait pas oublier, et c'est ce que nous avons rappelé ici aussi, que le virus pouvait continuer à évoluer, la pandémie pouvait continuer à évoluer, et que donc il faudrait que nous adaptions notre réponse. Donc, est-ce que tout va bien dans le meilleur des mondes? Bien entendu que non. Il y a des pays où les taux de vaccination, je te le rappelle, sont effectivement bien plus bas que ces 70%. Et est-ce que nous considérons que 70% est suffisant? Non, il faut que nous ayons un taux de vaccination supérieur lié à d'autres mesures afin d'avoir les meilleures chances possibles de vaincre la pandémie. Mais je trouve quand même qu'il ne faut pas oublier la situation dans laquelle nous étions au début de l'année 2020 et là dans la situation dans laquelle nous sommes à l'heure actuelle. Et même si la situation actuelle est effectivement source de soucis pour tout le monde et amène les gouvernements à prendre des mesures, elle est incomparablement meilleure que ce qu'elle était lorsque nous n'avions pas de vaccin. Et nous allons continuer à travailler avec nos experts, avec les entreprises pharmaceutiques, avec les autorités nationales pour nous assurer de mettre en place des stratégies qui vont nous permettre de continuer à faire face à l'évolution de la pandémie. Ok, je ne vois qu'une seule main levée, ou plutôt je vois deux mains levées, mais une, celle de Lukáš. Lukáš, you haven't asked a question yet. You have the floor on this, if it's on COVID.
Yes, hi, Łukasz Osiński from Polish Press Agency. It's also about COVID. Internal Market Commission, Thierry Breton, said on March that Europe can achieve herd immunity against COVID in mid-July. So I would like to ask whether Europe achieved already this herd immunity against the virus, and if no, why said so? And the second issue, what is the definition of the herd immunity according to the European Commission? Thank you.
Thank you, Lukáš. Look, we do not use the concept of herd immunity, but I give the floor to Stefanos.
I think what was very important in the messages that have been given in the past, the importance of going forward with vaccination. We started beginning of this year. It began a bit slowly, and then it took much more. Took some speed, and it was very important. And this is what we had already established in the beginning of the year, that we would reach 70%. In the meantime, we have reached 75%. The 70% was obviously based on scientific input that we received from our scientific colleagues. We continue to follow the situation. We see that we have, in some cases, reached very high vaccination rates, but in other cases, we also see increasing infection rates. And on the basis of this situation, we continue to monitor the situation and continue insisting on vaccinations, because this is what matters, that we continue our vaccination and that we take the necessary non-pharmaceutical measures to make progress. Thank you.
Lukáš, you have a follow-up.
No, sorry, I don't have it. I just forgot to speak.
Anna, I see you're asking for the floor again. I have you one question. Go ahead.
It's on what you are, my reflection and question upon what you have said now, because basically we are not talking about vaccination so much, but about boosters, because majority of the countries already reached the goal of 75%. So they are boosters, and after boosters, most probably there are more boosters. So my question is, how it will reflect on fundamental rights, because now we live in modality where human rights, fundamental rights are permanently restricted. So does it mean that these fundamental rights would be restricted indefinitely as long as the pandemic is going on? And I would like to remind you that, for example, Ebola has been lasting now for 40 years. That's why my concerns are justified.
Thank you. On boosters, yes. Stefan.
On boosters, as we do with all other topics in the area of health policy, and in particular our vaccination strategy, we listen to the science. We listen to EMA, we listen to ECDC. EMA has made an opinion, as you know, about boosters. It has made a distinction between two types of boosters. Additional doses that are given to people with weaker immunity systems, older, frail individuals that may be more prone to infections. We also see, as I said before, a slightly waning effectiveness of the vaccines given to these more frail individuals. On the other hand, for these boosters, the EMA has given a very clear opinion that such boosters can indeed be considered to increase the protection of these people. In addition, EMA has made a very clear opinion or guidance on additional doses to anybody else, so people who are not in this category of frail, weaker immunity system, where in that case also EMA has said that administering a booster rather, 6 months after the full vaccination may indeed be considered to strengthen or to improve or to reduce, I would say, the risk of infections. And this is what we're following, and these are the recommendations that have been made by EMA, and it's up to the member states to see how they integrate this in their vaccination policies and see to what extent they want indeed to go ahead with boosters for their for certain target groups in their population. Thank you.
And on the issue of fundamental rights, Anna, I already gave you an answer when you asked this question some days ago on Tuesday, I believe, and I have nothing to add to what I said at that point in time. Remo, une question sur sur Covid.
Pardon, non, c'est pas du tout sur le Covid, mais je peux poser quand même?
Attends, j'attends de voir si j'ai encore une question. Anna, I'm sorry, we have to move on. It's already been an hour that we are here, so we will now close the chapter on COVID and move on to other issues. And I give the floor to Anna Pinto, who had been asking for the floor before. Go ahead.
Good afternoon, everybody. I'm sorry, my camera is not working. I have a question on environment. It's a report issued this morning based on official data, revealing that last year, 1,000 of tons of banned pesticides, which are very, very poisonous for bees, were exported by member states. And I'm sure you haven't had the time to see the report yet, but I understand that the EU chemicals strategy for sustainability, that's from October 2020, in that strategy, the European Commission committed to prevent the export of hazardous chemicals banned in the EU. So I'd like to know if there has been taken any actions for implementing this objective. And also, if I may, I have a second question. Yesterday, the Commission announced a plan to ban imports of agri-commodities linked to deforestation, and that is regardless if the removal of trees are considered legal in the exporter country. So I wonder if the same criteria should not be applied in this case too. I mean, if a chemical is banned in the European Union because it killed the bees, Does the Commission consider acceptable that member states exported and poisoned the bees in other countries? Thank you very much.
Thank you. I'm not aware of this report, but Vivian, perhaps you can specify once again what our rules are.
Thanks very much, and thanks, Anna, for the question. It's a lot of very many different aspects that you raised, so if you could really please just send it, let's talk afterwards also so that I can come back on each and every part of the question that you had. But just to be very clear, where we are on the waste management, indeed, yesterday we came with this proposal of an amended regulation to make sure that we don't export our waste to countries which cannot deal with it. So in our proposal, we are now proposing to have concrete limitations and making sure that the countries which receive the waste have capabilities to deal with them. If they don't, they wouldn't have it. On the chemicals, indeed, last year we had a proposal also on banning the hazardous waste being sent to countries which are not capable of dealing with that. When it comes to the pesticides, that's something which in our Farm to Fork strategy we have taken the commitment to bring down the use of pesticides considerably, I think by half by 2030. And the work on that one is ongoing with our member states. So all of those topics that you raised, they're very much linked, of course, to our objectives of the Green Deal. It is on one side to become carbon neutral, which is the key aim, but it's also to make sure that our environment is clean, that we don't, that our food is clean, that we are taking care of all those things and making sure that we don't have any more pesticides that are strictly necessary, don't have the antibiotics, so on. So all of those things, we'd be happy to discuss in more detail if we can get back to you afterwards. Thank you.
Okay, thank you very much, Vivian. It's 1 o'clock. We will now move to the press conference on the review of competition policy. Thank you very much. See you tomorrow.